A very good evening to one and all. I invite you all for today's ANUBHAVA free webinar series. So the ANUBHAVA free webinar series is organized by Ayurveda Map, and it is sponsored by Dr. P. Ali Kutti's Kottakkal Ayurveda Pharmacy. Dr. P. Ali Kutti's Ayurveda Pharmacy has been a part of its mother concern, Dr. P. Ali Kutti's Kottakkal Ayurveda and Modern Hospital. KP manufactures around 400 classical products and 40 proprietary medicines in their own GMP and ISO certification. They also develop ancient formulations into proprietary medicines after a series of tests and research at their R&D lab. They also have food and nutraceutical division products, which has a variety of dietary and nutritional supplements also. So if you need more information, you can contact Dr. Jasul. So Ayurveda Map, it was started by a group of young doctors in the year 2016 and officially inaugurated by Dr. P.M. Warrior sir in 2017. So first we had our in-hand practical sessions. So these are the in-hand practical sessions that we had. Then due to the COVID conditions, we had to switch on to the online classes. So with the warm responses that we received from our participants, we switched on to the online sessions. So these are online sessions. So we started with Varnyam, then Brajaka, Gala, then these are our online classes. We also started a new venture, that is Svadhyaya, to support the students academically during the pandemic time. So we give away recorded classes, detailed notes, one-to-one doubt clearance, etc. And also we have started a one-year post-graduation diploma in Ayurveda Cosmetology also. And also next, we are starting a new session, that is Rekha. It is regarding the different Ayurveda general practices. So this will be told to you very recently. So I invite you for today's Anubhava series. So today we have regarding the understanding and management of the Parkinson's disease, and it will be taken by Ashtavaidyan, Professor Dr. Alathiyur Narayanan Nambi sir. So while speaking about him, he is presently the principal and chief physician of Ashtangam Ayurveda Chikitsalayam and Vidyapeetham, Kuchanada, Palakkad, Kerala. He is also the honorary director of academic and clinical services of SNA Aushadashala. He took his BAMS from Mysore University, MD from Rajiv Gandhi University, and he is pursuing his PhD from SVMC University, Tamil Nadu. He has been contributing in the field of Ayurveda education, research, pharmaceutics, and healthcare policy matters in India and abroad since 20 years. He is a popular in international teaching schools as faculty member of Ayurveda. He was awarded with Ashwini Award in 2011 by Padma Bhushan Shri D. Virendra Hegde at SDM Institute. So I invite you, sir, for this Anubhava free webinar series. Over to you, sir.
Am I audible now?
Yes, sir, you are audible.
Okay. Yes.
Yes, sir. Screen is also visible.
Everything is perfect now?
Yes, sir. Perfect.
Okay. So good evening, one and all. It's a great pleasure again to speak a fine Sunday evening after my spiritual routines. It was very pleasant for me to speak about a disease named Parkinson's disease. Actually, when we start learning about different movement disorders, we'll speak a little bit modern perception first, then followed by Ayurvedic perceptions, so that we could able to bridge and connect each other in a peculiar way. So if we try to understand the disorders related with movement, we may able to classify them into three. One is an akinetic, that means that will have a slowness or a rigidity type of presentations. Another category called hyperkinetic, where we have hyperactivity of things. And third category, it's an ataxic, which is very commonly we see an irregularity of the movement. Very oftenly we see in the clinical practice with spinocerebellar ataxia, etc. In the akinetic category, we have many diseases. One of the common diseases is Parkinsonism, maybe stiff man syndromes, etc. There are many diseases that comes in that kind of a sort of bradykinetic situations. On the other side, we have hyperkinetic issues like chorea, or maybe myoclonus, maybe different type of dystonia, focal dystonias and other dystonias, or balismus, or hemifacial spasms. There are many hyperkinetic, even in the later problems of the brain, like Jacksonian fits, many things, many hyperkinetic movement disorder also can be seen in practice. Again, we see a lot of ataxic categories like spinocerebellar degeneration manifesting into this. But in general, whenever we look into a movement disorder, anatomically, it is very clear that it refers to certain area of the brain. For example, Parkinson's, there is a clear-cut damage in the substantia nigra, like that in the chorea where chorda nucleus has a problem, or in hemibalismus, subthalamus nucleus may have problem. Like that, a certain area of the basal ganglia, certain area of the brain is very specifically get disturbed or very specifically get damaged is often to be recognized for clinical identifications, and it also will help to know how this disease is progressing or how the disease is taking its step forward. Now let us come to the area of again the PD. I often use the word PD, means Parkinson's disease. There are still, it is not very clear about the single pathological reasons to have it, but pathologically it is a neurological loss, maybe due to a degenerative problems, maybe the age. As the age passes, people are more vulnerable to manifest PD. It may be a traumatic, sometimes may be a traumatic situations, very often head injuries, even the psychological injuries also may produce. I met with some of the patients. I will say in the last, if there's time permits, some of my personal situations where I found that are tremors manifest after psychological trauma too. Then vascular, many vascular problems also can produce PD. Toxics, definitely many toxic MCTP, like many toxins can produce Parkinson's disease. There are even the drugs, many drugs like the drugs used in hypothyroidism called lithium. Not used in hypothyroidism, used in the mood disorders. But that in turn produces some problem in the thyroid dysfunction. It's also produced some of the reason to manifest Parkinson's disease also. And infective pathology is also there. Basically, it says that there is an accumulation of an abnormal proteins as a like a Levy body, which produces some damages in the cell membrane and organelle. And that because of that, there is a neurological death, and that may be the another reason to get the pathology. And maybe some genetical susceptibility may be there. We have seen some people, those who are genetical susceptibilities. Head injuries are another very common. The famous boxing champion, Mike Tyson or somebody, had Parkinson's disease because of the continuous hit on the head. So there are so many other things. Another category of the disease is Parkinsonism. It is slightly different from the Parkinson's disease because Parkinsonism describes the presence of extrapyramidal movement, disturbance of the manifest by the combination of the rigidity and bradycardia may be there, maybe with or without tremor. There may be a resting tremor, not an intentional tremor. As we rightly see, you see the people, if you ask a Parkinson's patient to write their name or put a signature, definitely they will try to do like this. Or some, they have a bradygraphia or macrographia, difficulty in the graphing problems. And of course, you all know very well that this disease will manifest. It can be clinically diagnosed without much investigations, even though many investigations may be confirmatory to prove the situations. But in generally, if you get a patient presented with a rigidity, complaining of difficulty in movement, especially walking, like a bradykinesia, or the patient complaining of rest in tremor, a mild tremor, generally pinrolled tremor like this, or the person complains of postural instabilities, or a family members identify the person is like a freezing situation, or if the person is having a slight forward lean, a flexor postures, these are all directing a neurological manifestation. Definitely, it may point out towards Parkinson's disease. So by clinical examination itself, we may able to come to a nearer to the diagnosis of Parkinson's disease. But of course, we may make use of some investigations. We may make use of some other aspect to think. And there are sometime along with this, the so-called the cardinal features, we may also see some of the unusual clinical presentations like unilateral rest tremor. That means even in the hand or a foot is rest, generally it sees in the hand. There may be a tremor in the areas. And when the person walks, there may be a decreased arm swing, because normally when we walk, we have a tendency to move our hand swinging. So there may be a slight swing less, very significant in the clinical observations. Maybe patient complaining of shoulder pain. They say they have a difficulty in raising the hand. One of my patients says, "Doctor, I was not able to fold my shirt of my hand because it's not because of the tremor, it's because of the shoulder pain. He is not able to do." Bradykinesia, which already we spoken, that means slowness of movement. Slowness in the sense it depends upon the type of composition of the person. If the person is very Vata Prakriti, the family members might identify much earlier. But if the person is very Kapha Prakriti, he may not be really knowing the different family members, may not be really able to recognize it in the early stages. Bradylalia. One of my recent patient's family member complained that, the daughter complained that, "Doctor, my father is not communicating me well. He stopped speaking. He is always thinking something. Does he is undergoing any depression?" So bradylalia is a very slowness in the speech, as well as the total time of the speech is really reduced. Rigidity, very oftenly seen person complaining in the rigidity in the hip, in the shoulder areas and all. And many times they will have a masked face. That means very hypomimia. That means expressions are very less. Nowadays, this is a big challenge because where people are wearing the mask, and when we get the patients of Parkinsonism, definitely we will not be able to appreciate does the patient is really expressing or not. But look at remove the mask and you just start communicating the patient. Let's see whether the person is smiling, whether he's really able to communicate the expression well. The sorrowness, the anger, or the disappointments, or the hopeless feeling, whatever. But generally, they will have a very masked face. They are just in the same expression. So there's another common thing. A decreased blinking rate. If you sharply observe the eyes, the blinking rate is really very, very low. And also some people, there may be a salivary drooling will be there. Micrographia, as we have seen in the previous slides, there is a difficulty in the writing. And also when we ask the patient, of course, after seeing all these things, we'll just ask the patient to, we look at the signs like whether he's able to walk. So you ask the patient to walk and then just ask them to turn back. So the person will have feel difficulty or he may fall down. Unstable, slow, shuttered walk. They will put a slow steps together. Oftenly they will have loss of balance. They are trying to get accidents very often. Very oftenly, Parkinson disease people get accident, especially in Indian roads, because there are always people are in a hurry to cross the road and traffic will be a bit high. And when in the Parkinson's people, the biggest challenge is that they have a problem of the acceleration and the brake. A car which is have very poor acceleration, poor brake is unpredictable in driving. Similar way, the person want to cross the road. So his acceleration is very, since because of the bradykinesia, his mind is ready that, okay, let's move. He will start moving, but not to the pace what he expected. So what happens from the wrong distance, maybe at 200 meters or for 300 meters away or 500 meters away, a lorry is coming, a truck is coming. So this person is start walking in the road, and when it reaches the middle of the road itself, see, because of that pace, slow down in the pace, he will not be able to reach to the time which he calculated and also calculated by the truck driver. So he may hit. This is very common that Parkinson's disease people get accidents. Not only big accidents, also minor accidents like bike or cycle hits them very oftenly because they have a difficulty in their movement. In the contrary, when they getting down, for example, if there is a sloping down, normally we get our own foot is having great braking system so that we could able to manage. But so far the PD patient is concerned, they will have a big problem because of the autonomic systems and as well as because of the rigidity other thing. They will lose the control and they tend to lean forward and fall down. These are to be very careful while we take the history. Another thing is that many times they may have some gut disturbances, especially postprandial bloating, constipations. After food, they say, I have some gas and other things. And maybe a urinary frequency urgency, incontinence may be there. Maybe if it is an elderly people, maybe it may be associated with BPH, benign prostatic hypertrophy, or it may also extended to the impotence. And there are other things also we could able to differentiate is that disorders of sweating. I want to say these are list of things we observe in the patient. You don't expect that all the things will be seen in one patient because there are out of some 30 or 20 or 25 symptoms, we will see 5 to 10 in the patient. That itself is more than enough to diagnose and start planning treatment. So disordered sweating, they will say when everybody feels cold, I feel sweating. Like they have difficulty in our temperature management system maybe also altered. Another thing is about the osteostatic hypertension. When they are in the bed, they have difficulty in sitting up. But if they sit up, they feel that there is a giddiness. So because of the osteostatic hypertension. Maybe some cognitive or behavioral changes. Very oftenly, the wife or the husband get Parkinson's disease. The other family partner will say that nowadays he has some disorientations. He says his behavior is very unusual. Sometimes he shouts. Sometimes he become very not reacting to the expectations. Again, attention and concentration wane. There is a gradual decline of attention and concentration. The people who are voracious readers will stop reading. The people who like to go for walking, not able to go like that. And even 30% of the global dementia is a contribution from Parkinson's disease, even 40% in the anxiety and mood disorders. So many times mood disorders also interrelated, or it has also connected to PD. So we have to take into consideration of that too. Many times maybe people were given some mood stabilizers or some sleep enhancers like alprazolam and all, anxiety-like things, or because of their complaining of the nocturnal sleep fragmentations. And along with that, some people may have some restless leg syndromes, already you may be knowing. Some vivid nightmares also, they will complaining of horrible nightmares. They will say, I cannot sleep because of this nightmare. And some people, rarely, they also have coprolalia. That means they will speak very bad words repeatedly. They may be, when before disease, this person may be very gentle, very great gentleman, never use abusing type of sentences at all. But after the manifestation of PD, they may start saying unexpected words, which may especially the family member maybe felt shame, or they felt very much absurd by the type of speech they will have, which is called coprolalia. And if you are a practitioner, you have to be very, very careful, because there are some red flags in PD diagnosis. Okay, you get a Parkinson's disease, you start treatment, and you will get very good result in the initial stages. And many clinicians say that, okay, later on, after a few years, I'm giving some treatment, but I'm not getting result properly. So why they are not getting so result? Because you have to be very careful about the progression of this disease. And I just put down from our experience about some red flags. If the persons manifest early or a prominent dementia, you have to be more careful. If you have a symmetrical signs, or if the person is having some bulbar dysfunctions, like in progressive bulbar palsies in the motor neuron disease and all, or if the person manifests with a gait disorder in the beginning, early itself, falls within first 1 year, normally this will not happen. If the person is directly depending upon the wheelchair within 4 or 5 years, these are all red flags, because this kind of progression of the disease is so fast, and it shows some early autonomic failure, and the condition is not. So if you are really a practitioner, be very careful, because take good cases and bring better results. If you are suspecting some very chronic situations and this challenging situation, better you combine Ayurveda as well as the modern medicine. Maybe Zindopa may be given on parallel. Of course, we'll speak that time. The Parkinson's and other type of drugs and all. We'll speak dealing with the treatment. Is the patient complaining of sleep apneas, excessive nightmares, or apraxias, not able to do things, or gasping type of respirations, or feeling like alien limb, or cortical sensory loss, and these are some of the set of red flags you have to keep it in mind. If you find these type of situations in the Parkinson's disease, it's normally not seen in the usual Parkinson's disease, but if you find these type of things, few of the things, little bit careful, because the disease progression is little more faster, little more complex. Keep it in mind. And let me put some of the non-cause for this problem. One common problem may be due to the lithium, even the reserpine. So nowadays, people are using antihypertensive drugs in Ayurveda. They are using the sarpagandha. Maybe the whole plant sarpagandha is taken, may not have much problem. But if in many companies may be using the extract of sarpagandha, the reserpine alkaloid. So far, there may not be any significant issues, but reserpine, many studies in the reserpine found that it has a suicidal tendencies, it has a mood disturbing tendencies, and mood disturbing issues and all. So be careful about that. Then cinnarizine or ethanol, there are many things. Other things like MPTP is very established. MPTP is an established toxics or toxins for one of the major reasons for Parkinsonism. Carbon monoxide inhalations, manganese, cyanide, methanol, pesticides, environmental metals. Nowadays, if you throw back to the Parkinson disease, many people have these possibilities that we have to reduce our usage of pesticides, we have to reduce our usage of heavy metal contaminations like mercury, cadmium, zinc. There are many other things. And it may also occur due to infections, especially the post-encephalitic issues and all. Also can manifest as a lacunar infarct. The stroke, a patient might have had lacunar infections in the MCA, vertebral artery, and later on he recovered from the stroke. In the later courses, he may end up with Parkinson's disease, another common reason. Maybe Wilson disease, like other calcium metabolism disturbance can also produce. And some structural abnormalities in the arteriovenous malformations or tumors in the brain also can produce. Multi-system degenerations like progressive supranuclear palsy like PSP, MSA, OPCA, like these type of brain-related multi-system degenerative disorders all can manifest as a Parkinson's disease. So as I told you before, Parkinson's disease is a manifestation, but if you retrospect the nidana, the causative factors, there are maybe other things. Multiple repeated traumas like head injuries, very common to manifest Parkinson's disease. As I mentioned you before, that generally we can diagnose these conditions directly in the clinical setup without doing any much investigation. But if you are very particular about it, definitely serum and urine copper, which we can exclude the possibilities of Wilson's disease, serum, ceruloplasmin, liver function test to exclude some other possibility, thyroid function test to exclude other possibilities, maybe serum calcium to exclude things. Or you take directly CT, MRI, PET, etc. Then you'll get the pictures. This is a cadaver dissections where you will see commonly the typical changes in the thing. These are some of the examples. So now let us understand a little bit from Ayurveda. A disease where a various combination of Vata and Kapha gunas are seen pathologically. Generally, when we have a disease like Vata Pitta, Pitta Kapha, Kapha Pitta, these things combinations are generally easier to treat. But when we have Vata Kapha combinations, generally it is difficult to treat. And here you have two types of presentation. One is a tremor. Another one is the rigidity type of category. So you see, when you see the people in the Parkinsonism, some people will have a lot of tremor. Mainly they complain with the tremors. Whereas the other category people will have rigidity, that means the rigidity dominant. So Shida Yuksha combination tremor. So tremor is a predominant condition. So we have to be Ushna Snigdha. So generally we can think about a Brahmana type of treatment may be better whenever there is a tremor is there. So when we look into Charaga, Chikilsa Sthana, the 28th chapter, Vadavyadi Chikilsa, he says the pathological things happening to the Vada is that Avyahada Gadi Sthanastha Pragadingada. So Avyahada Gadi, Vada, if Vada had to be in a normal situation, you should expect that Vada should travel uninterruptedly. Avyahada Gadi, no Vyahada Gadi to at all. There is no obstruction to the flow of the Vata. Sthanastha, it should be in its own site, not going to Anyasthana Gada, not going to Amashe Gada, Bakvashe Gada, Buddha Gada. No, nothing is permitted there. If you want Vata should be normal, so Avyahada Gadi, Sthanastha, Pragadim Gada. That means not to have Vigridi. So these are the three basic categories Charaga explains in the 28th chapter, 4th shloka, 4th or 5th shloka, very importantly mentioned. So what happening here is that Avyahada Gadi is also there, Vigridin Gada is also there. So you have a combination of all the things. Initially maybe started with an Avarana-janya pathologies, then later go to Dhaduksha-janya pathologies and so on. Generally, in the rigidity dominant conditions, Shita Snigdha combinations are more things where we have to do Lankana. Generally, if you choose Shita Guna, it will have Anupashaya. Be careful that better not to use Shita type of things. So now we'll come to the Ayurvedic perspective. So modern perspective, you already know a lot of things, which even in the internet, you get a lot of informations. From a Brahutrai or Lagutrai, directly you don't get any descriptions which is nearing to the Parkinson's disease at all. We have some descriptions like some symptoms of this what do you say, symptoms of the Parkinson's disease. Kabhavrata Vyana Lakshanam, I'll explain in Gadi Sangha Tadodhikaha, Gadi Sangha. So there is a bradykinesis is also explained. Hyper tremor is also explained. Gadi Sangha Tadodhika. So Charaka explains about Kabhavrata Vyana, he explains like that. Similar way in the Vagbada, by telling about some medicines like Maharasna Dikradam in the Kasachikilsa, Panjakasam, Chirakambam, Shoni, Vankshana Vedanam. So Panjakasam, five varieties of Kasachikilsa, he mentioned. Panjakasam, Chirakambam, typical dystonia and head tremor is described. Maybe that tremor is not related with movement disorder of the brain, maybe related with the cough related things, but still that word is there, Shirakambam. So Kamba, Stamba, Chestahani, these type of things are randomly described in the Brahatrais, like Samsavyasa, Vedasava, Sadharuktoda, Bhedanam, Sanganga, Vanga, Sangoja, Varta, Harshana, Darshanam. Vagbada says these are all different type of pathological manifestation that can manifest in the Vadavyati. So Kamba Parushya Saushidya. So Kamba Parushya Saushidya. Then you will see these are things, many things in the Parkinson's disease. So fundamentally, what we can understand from the Brahatrai or Lekutrai, of course, it is a Vadavyati. That's enough. If you want to take a diagnosis from a textbook perspective, okay, starting from Jara to Vadarakta, okay, it comes under the chapter of Vadavyati. That is enough. And what more, if there is a description of Kambhavata, Kambhavata is not described at all, but the word Kambhavata as a disease is described in a great book called Basavaraji. Nolimbaraja has written a Basavaraji, a 16th century book. He described this. There are some medicines also, which is having in the Phalashruti, they mentioned this type of Kamba, just like in the Maharashtra, the Khudam. Varunya Uttaram Moolam, Guttidam to Balatrayam, Hastakambam, Chirakambam, Manyakambam, Tadevacha, like that in the Varuni Dailam, they describe Hastakambam, Chirakambam, Manya Stambam, Tadevacha, like that. So in some Aushadha Valashrutis also, we get these type of things. So since there is no independent descriptions in the classical textbooks, we are lucky, no need of argument. Okay, let us take this as a Vadavyati. So we are free to think and make our own postulations. One way it is a big advantage that there is no direct description. So we can make our own Samprapti. We can think about our own Nidana. We can Hedulinga Prasamanam, Yogadam Apunarpom. So we look at the Hetu, then look at the Linga, that is the Lakshana. Prasamanam, think about the different possibilities of it. Then Apunarpom, how to reverse the situation so that it will not come again. But in other side, since there is no much description in the classical book, we may end up with some confusion how to manage this problem, because it is a very common disease nowadays. When we get any movement disorders in the clinical practice, Parkinson's disease is one of the most common diseases in the modern clinical neurological department, and there many times they will end up with a lot of complications too. So generally, whenever people get Vadavyati, especially like these type of diseases, they will try some modern medical things since they don't get an adequate result, or they may have a higher expectation in the phases of the recovery. They have a belief that Ayurveda can do miracles, so they will approach to Ayurvedic clinician. So it's a time that we should think about what it is happening, how these things have been done. So let us name it as Kambhavata, because Kamba is the tremor is the cardinal symptom and it is a Vadavyati. So Kamba Vadavyati, let us take. So we may have a hypokinetic movement disorder. We may have hyperkinetic movement disorder. like as I mentioned in the before. Maybe disorders makes some imbalance like a toxic one. All this we consider comes under Vada Vyadhi. Of course, we know that Parkinson's disease is named under the James Parkinson's. So you see, I put it in a different way. The movement disorder into pyramidal symptoms where you have spasticities, and the basal ganglia disorders where you have hypo and hyperkinesia. Or in the again you put it into this hyperkinesia, then you can put it into chorea, clonus, tremors, etc., etc. Just for your idea, basically neurological diagnosis is much more easier because it's like a machine. If a machine has some problem, then a good mechanic will be able to identify very specifically from where this problem comes. Similar way, in the neurological, the beauty of the neurological science is that if you study neurological examination very thoroughly, physical examination is one of the most powerful tool in the neurological system, which you are able to exactly know from where the lesions comes. So it's very clear because there is an established method. Method is there. If the lesion, for example, if you have a stroke, you are very simple, you know how to differentiate between upper motor neuron lesions or lower motor neuron lesions. It's very simple because it's like a machine, you are able to know. But if you trace back to the etiological factors, there are a lot of difficulties because etiological factors is very complex. And many times patient party may be expecting that we'll say what is the cause for it, how to solve this. Anyhow, why I want to say this, because we have to think from Ayurvedic perspective also, because modern perspective is wonderful to know the pathological things. When it comes to the treatment perspective, okay, you see the usage of Zindopa or the dopamine. You may use the use of other dopamine stimulating drugs. It's not addressing the real pathological problem. Of course, there may be symptomatically person may be feeling better, but our approach is much more superior than the modern neurological system. It is not my sentence. It is told by many of the leading neurologists in our own country itself. They told, okay, Ayurvedic treatments are even much superior. I found because the quality of life with Ayurveda, Ayurvedic people are able to improve the quality of life of the Parkinson's people than us. Many personally, many of the neurologists has told me in a phase itself. But these modern informations are very helpful for identifying the pathology, identifying the etiological factors. But when it comes to the treatment and all, these things will not help us. So if you want to treat according to Ayurveda, because we are Ayurvedic physicians, clinicians, so we have to treat according to Ayurveda. So now leave all other things aside, think from Ayurvedic perspective. What is this problem is? So how these things are started. So it is affecting an Uttamanga, the head. Head is one of the Trimarma. In Charaka describes about Sangho Marmastrayam Raktod Shigudam. There are Deshemani Taranya Prana Yeshu Pradishtuda, Shanko Marmastrayam Kando Chukroj Rektam Chukroj Sigudam. So like that. So it is a head, Mastishka, Devasti are one of the three marmas important. So there may be Mastulinga marma may be affected. Very important thing that because we are to treat a marma. And many times the lifestyle problem, very common nowadays, alcoholism. Very strong Vada stimulating food habits. Nowadays people are eating too much of spicy things, too much of kattomla levana, ati sevana janya. So pitta prakopa, also some vata prakopa. Very prone for the people to get vada vyadhi because of this type of food, alcoholism, smoking, like maybe even nowadays with the drug, very common thing. And importantly, the role of pollution, especially the air, water, soil pollution has a major role to play. It's not because of our mistake. It may be because of the vegetables what we get, maybe get highly added with the pesticides. The food what we take, the younger generation people will go to, even in the older people sometime, go to the street and they want to take different street food exploration. They will try to use different type of food. Once in a while they will go, not once in a while, very often they go to hotels and they want to have a different type of food. maybe some different continental food, it may be Arabian food, it may be many other countries' food, which may be added with some preservatives, some coloring agents, some tasteners and all, which in the long run, these are all having a big challenge and maybe a contributor factor to Parkinson's disease. Lithium, sodium valproate, anti-emetics drugs very oftenly as a cause for Kampavata. So when we have Vega Vidharana, anti-emetics, Vagbada says in the Rogal Padnya Adhyayam, Atho Vadasya Rodena, Gulmuda Avarta Ruklama, Vadamutra Sangu, Dushti Agnigada Hridgada. Even the Netra Roga, Hridroga can occur if you are holding Vata, Atho Vada, flatus problem itself. That much internal Panchadosha dynamism is very effective. If you are disturbing this Panchadosha dynamism, like anti-emetic drugs, it may end up with some Vadavyati later on. In the modern science also, Ayurveda also says. Consumption of manganese, carbon monoxide, mercury, aluminum, copper, I mentioned before that presence of heavy metal is a large challenge nowadays. Even even Ayurvedic medicines nowadays. I have been teaching Ayurveda from last 20 years to many European countries. I am used to meet a large number of Western patients every year. So many times after the treatment, while traveling back, they will carry many medicines. They will have, one of the questions they will ask is that, doctor, are you sure that this medicine is not having any mercury, lead, all these heavy metals? So I was a little bit cautious about it, because if at all they are able to identify some heavy metals in that, they will sue me. Since I'm inside India, there may be a lot of possibilities to escape from because of the Indian jurisprudential system. But still, I have to be very careful, I found many times. So consumption of heavy metal is a big challenge. Then the concept of Dushi Visha. Dushi Visha is a very thing. Janabadodvamsa, the problem of Janabadodvamsa. These are all contributing to the Vadavyati. And what clinical manifestation we get? Stambha Gamba Cheshta Hani. So maybe a Smrti Brahmsha may be there. Then maybe Nidranasha may be there. Maybe person is having vertigo, Vaksangam, there may be difficulty. Also, Krura Kostada, as I mentioned, there may be gut disturbances or constipation may be there. Urograha, chest, heaviness of the chest, something may be there. Or Bhaktarodha, Karananasha, Krananasha, loss of smell, sometime they will say. These are very common things we see in the patients, and we can take that into mild, moderate, severe in that category. In that way, we could be able to. Okay. So initial phase, the tremor of one hand, maybe some hands may be leg, one side maybe face may be slightly affected, mild expressions. So it may slowly go to the speech abnormalities, maybe slowly to that mild into next level. So like that, it may be, as you see in the slide, it's slowly progressing. The severity of the progression will happen, and later in stages, they will be in wheelchair. It takes few years, not one day. If you are a good clinician, you will get an early diagnosis of Parkinson's disease. At least 7 or 8 years it takes for a person to have a if not able to walk situation, or standalone situation, if not able to standalone situation, all. These are all things will happen only after 5-6 years. So you get an ample time to study the disease, try to know the pathological process of the disease. Even you are able to get we are able to get enough time to think about doing the best for the disease, even though the result may be less. Some of the fundamental things we should think in this case of Parkinson's disease is that Chirakalina Sanjita Dosha Avastha is the major problem, because because of the wrong food, there are a lot of things happening in the Koshta, especially from the Koshta. There is Dhadulina Amavastha is there. So Ama is taken from the Koshta, went into the Dhadus, and it is so adhesive, so attached into Dhadus, so that it's a long-standing dosha accumulation. That's a big challenge. That's why many therapies may fail even in the process of the treatment. Another thing, Bija Bhaga Avayava Drushti, maybe a genetical factor may predispose us. And Marmabhiga, the head injuries are very, very common thing. I had a patient presented with a tremor, a typical tremor, and initially started with the first level of Parkinson's disease. So later on, it went into second stage very fast within a few months. I was very suspicious about. He was quite young, not like 50 plus. He was around 35 or something. So I started asking this patient, "What happened to you? How did it started?" So he was telling a different story, very interesting. So he was driving a car and he met with an accident. A bike person crossed in his car and he hit the bike, not very fast, in a slow speed because it was junction. And when this person hit the car, the bike guy he had wear the helmet, but he didn't put the buckle. So the helmet bent out and he fallen down. He didn't have much injury, but the moment when the driver, the person who seen the helmet is going up, he found that the head of the person is broken, head is going up. So he had a very deep mental trauma at that moment. So he was like a shock. Then after a few minutes, people came around and took that person, when taken to hospital, and this person also not able to drive, and somebody helped him to back to home. This was incident happened to him, and after this happening, after a few weeks onwards, he started getting this trauma. Very interesting case, and the disease was quite progressive. It was very, very challenging to me, but I also tried some psychotherapies, some hypnotherapies and all with one of my friends, so which helped better. Okay, then another situation is about the Tridosha Dushti. We have to analyze the problem. Generally, Pitta involvement is very, very less. Generally, either Vada Kapha dominant, where you have tremor dominant, or we have Kapha Vada type, where you have a rigidity dominant. If you look from Avarana, Kaphavrta Vyana avastha is there. There's a Stamba Pradhana Kaphavrta Vyana avastha is there. Sometime maybe a Kamba Pradhana avastha also may be there. If you look at from the Samhita, there may be Udana Vrta Vyana also have some tremor-like manifestation is mentioned. And if you look at the Bhela Samhita, it's mentioned that Asti Majjagata Vada. Asti Majjagata Vada, Bhela explains these type of things. Only for academic interest, but it's also very vital that involvement of the disease to Asti Majja is a very vital. That's why many of the Vastis will find very good result. Source of information from patient, friend, onset, duration, chronicity of localization, drugs, liver disease like Wilson's disease. These are all important for you to know from different stages. Things are very easy. And when it comes to the Kambhavada Chikilsa, so let us try to understand that Tridosha Dushti is there. But out of that, you have Vata Kapha type or Kapha Vata type is there. Gadi Manda and Shina Vak. Purve Vaisi Mathyeva Tatpatyam. So we have to start very early Rasayana. That is why Acharya says that problem might have already occurred 20 or 30 years before. So we have to have proper Dinacharya, Rudushodhana, Rasayana, and all. The significance of Dinacharya, Rudushodhana, Shodhanas are all that we could avoid these type of problems. Now, let us take into the Kamba. If it is a Kamba Pradhana Chikilsa, if the person is having more tremor, so we have to analyze this condition is Vada Pradhana Anubandha Kapha. Anubandha Kapha is there. Vada is the dominant one. So avoid Ruksha Shita type of treatment. Don't give any Ruksha Shita type of treatment. Rather, you give some Brahmana Chikilsa. Care about Ama, careful about Avarana Avasthas and all. You can start with an Abhyanga and see whether the person is feeling fine. Then you may go to Patra Bodhali Pindasveda or Kaya Sega, the Pichil, whole body oil pouring. Murdha Tailam, that is the Abhyanga, Seeka, or Dhara, Shirodhara, Tailadhara with Rasnadi oil or all gives very good result. And in between, try to give some Virechana Aushadas. Don't give a drastic virechana, give murdu virechanas like use Dashamula Haridigi medicines or some laxative with an Aranda Thaila also good. You may use Vasti and Nasya. I'll give you some more examples. If you are very particular that, okay, you want to heal this problem faster or improve the condition better, you can go for a Sneha Panam with a Mahamasha Thaila. Mahamasha Thaila found very good effective. Or even Santhanyandaram or Sajaradi Thailam, if you take into a Pano Vasteja Chikana Baga, Vasti Pano Vasteja Chikana, or the Asna Dashamula Kradam is in the Sahasra Yogam, a famous Yogam. Asna Dashamula Kradam is also very, very good. If you have the other side, if you have a Kapha Pradhana Bandhavada, then you the opposite side, where you should create Ruksha, Laku, and Sara situations there. So you do Langana Jilsa. If you conduct a Vamana, it is the starting stage, there is only few things are the tremor is there. If you conduct Vamana, the stiffness of the face, improve expressions and better movement, you will get very good result. If you are very particular about Virechana, then Eranda Thaila is very good. We get Gandharvastadi Eranda or Sugumara Erandam, very good. Sugumara Erandam is also good. Another oil is called Varuni Thailam. Varunya Uttaram Mulam Muttidam to Balatrayam, Hastakambam, Jirakambam, Manyadam Tadevacha. So there is a special yoga mentioned, very excellent in when you have Stamba Pradhana thing. Then you can use Tasya, Kridamandam. Shirogada Vada Chikitsa, Charaga and Vagbada describes about Kridamandam. So you to keep the ghee, then you have a manda. What is this manda? Means supernatant area of the fluid part type things in the ghee, that there's a sedimental part in the bottom and there's a supernatant part. Kridamandam is very good. Or Shirabala Thailam Nasyam or Thanundaram Thailam. You can use the Avartanam 3, 7 or 21 like that. Rasatailam, special yoga is there. Rasatailam is also very good. Nasyam with the Kabikachu, Belamulato, Kashuganda, Shirapaga, you prepare a milk, Shira Dashtagunam, Devya Dashtagunam Shiram, Shira Niram Chadurvidam. That one is 1:4:16 method. You prepare the Shirapaga and do the Nasya, found very, very good effective. There are very specific Vasti mentioned Vadavyati Chikilsa of Ashtanga Hridayam, found very effective. Dibanjamula Sirasamla Chachagamam Sasya. That some Brahmana Vastis are there. Rajayavanam, Mustad Rajayavanam Vasti. Again in the Kalpasthana Vasti Chikilsa, you will get many very good Rasayana Vastis. Vrishya Vastis are there. These are all very, very good in Kampa. If you are able to do Rasayana in the patient, Lashuna is a very drug of choice. Excellent, you can try. Sarvam Javaranam Vittarakta Samsarga Vivarjidam Rasayana Vidhana and Lashuna Handi Sevida. While explaining in the Vadarakta, Avarana, after Avarana, Vagbada says, Sarvam Javaranam, all the Avarana pathologies. Pittarakta Samsarga Vivarjidam. Exclude the situations of Pitta and Rakta. You try Lashuna, very good. When I was doing my post-graduation in 2000 and all in SDM Udupi, my teacher, Dr. G. Srinivasa Acharya sir, used to give a lot of rasayanas, Chitraka Rasayanam, Lashuna Rasayanam and all. Very excellent. He keeps sciatica patient. My patient thesis was on Ridrasi, sciatica. Instead of giving my medicine, he says, we'll give Lashuna Rasayana to this patient. Only Lashuna. In a peculiar dosage form, give Rasayana, patient back pain will go. Instead of spending a lot of money with Patra Botalis in the Swedam, Kadi Vasti and all, he give a particular situation. He know how to tackle this. That very specific avastha he identify. In such cases, he gives simply Lashuna Rasayana and patient back pain will go. So that's a trick we have. Many Rasayana, Kambhavada and all we should try. Lashuna Rasayanam, Chitraka Rasayanam, Shilajadu, okay. Mutra Jeshu Girijam. Most of the Mutra, the Vyada Vyadis, Shilajadu is the excellent one. Here also excellent one. So that's why many times Chandraprabha also gives which is containing a lot of Shilajadu, is a very good prescription in that. Brahma Rasayanam in the context of Rasayana it is mentioned. Swarna Basmam also very, very good. When it comes to Stamba situations and Kamba, different Ayurvedic Kashayas are there. So if you have a Stamba Avastha is there, that means rigidity is the dominant one. Try to use Ashtavargam, Velasa Jarenda Sundi Rasta Suradrumai, Ashtavargo Anilabha, that Kashayam, or Rasona the Kashayam, Rasona Garavi Krishna, Sirabi Sadidam Jalam. that Rasonadi Kashayam, where garlic is a dominant ingredient. Or you may use Bhadradarvadi. Bhadradarvadi, Vashamulam, Veladuyam, that yoga is there. Bhadradarvadi Kashayam. These are very good. The rigidity slowly come down. But if you are Kampa, the tremor is the dominant one, then Dhanadayana Shundi, Siguru, Rastogragandha yoga is there, which is more reducing the Kapha dominant situations. Maharasnadi Kashayam, very popular Kashayam, everybody knows. Vidaryadi Kashayam, that is Vidari Panjangula Chigali in the Shodhanadikana Sangram Yoga. Told for Vidaryadi Rayam Mridyo Brahmano Vadapitaha, for the Kasa Vada Chikilsa, in the Kasa Chikilsa, it can be used very well, but here also very good. Or mixture of Nayobhayam and Drakshadi. Belaji Raganagare is the Nayobhayam, and Drakshadi, which is mentioned in the Jora context. Combination of this is also very good. In Vaishya Ratnavali, there is a wonderful yoga called Mashatma Guptadi. Mashatma Parent of Vatyala Gashadam Bibed. Ingu Savarchadam Yuktam. Pakshakadam. Excellent yoga. Mashatma Guptadi. Even some practice also there in the Pakshakada to use Nasapanam for Mashatma Guptadi. Here you can use this because it's containing Masha and Atma Gupta. Very good combination is there. The drugs like these are all time-tested prescriptions. You see, we have been practicing so many years. So many people will met with Parkinson's disease. So these are all some creams of the prescriptions by our own ancestors, not only by me, my ancestors, like my father or Vaidya Madam. There are many legendary people. Even new generations practitioners also use, like Jomon Joseph in Kerala, one of the leading Parkinson specialists in Kerala in young generation. So there are so many people are using these type of products. Ashwagandha, Belago, Kshura, Kabigachu, Chariba Kashayam. Or Sahajara Bela Kabigachu, Shadahua Chirapaga is there. Vrishya, Medya, and Rasayana Chilsa. The best thing what we should do in all the Vrishya medicines have some result. All the Medya Ushadas you use in the Parkinson's disease, you will get some result. All Rasayanas are having some result. So this keep it in mind. Even Kabigachu, Churnam, 3 to 5 grams. 6th hourly, small amount. You give small amount, starting with small amount, you will get very good result. But be careful. In modern medicine, normally they should not start, generally they should not start with the dopamine in the initial stages, because once you start with that, then they'll be dependent upon that and condition will worsen in the long run. So if it's a very established neurological practitioner, they don't start with the Zindopa and all. Rather, they will start with some other, because of the synaptic disturbance. To improve that, they may use some other things. But we may start with Kapigachu and all, you get very good result. Whenever we want to have some gut disturbances and all, people will say the gut disturbance, you can use Dhanvantara Guliga or Shadharna Churnam, Darviga Linga Gaduvadi Vishagni Bada Yoga. Or you may use Dushi Vishari Guliga, very famous for many of the diseases and all. Or Kaivisha Parihari, which is a special formula mentioned, used in Kottakkal, Kaivisha Parihari, where you found many of these gut medicines. Just like Vrishya Rasayana, many of the gut medicines, Villu Adi Guliga, Brahas Kasturi Bhairavarasa, Manasamitram Guliga, these are all found very, very good. Even in Manasamitram Guliga, some stages, especially when you have a mood disturbances and all, it may be added in your prescription, find very good result. Most of the Medhyaganas, even Medhyagana, Vidaryadi-gana, Atmagupta, you combine these 3 combinations, 1:1:2, you will get very good result. Then, so it's almost 1 hour now. I started speaking. So I'll put it on discussion later. So I just want to put some of the important things now, that clinically, we found so many things abatya. One is the mushrooms. So if you have a patient of Parkinson's disease, tell them to reduce the usage of mushroom or stop usage. I don't know why this is having this problem. Also, cashew, badam type of things also found not very good. Dry fruits, chocolates, shellfish, and also food preparing in aluminum and copper. Especially people will make this aluminum tawa for some things and all. It's not good. Better tell them not to use aluminum, copper vessels for preparing. Okay, copper vessel is good for cooking the rice with the water and all, because copper has that type of effect is there, but not for anyhow. Very importantly, this and few patyas also there. Unpolished rice, that which is having the rice with unpolished one. Cereals, goat milk found very good. Grapes, leshuna, moringa, of course. Goat milk and sarshabatala. They are using cow's milk. If they have a source to get goat milk, better to switch on to goat milk. Very importantly, pranayama, meditation, excellent. We can combine with our treatment with the pranayama, meditations. Regular light exercise is very good to reduce the rigidities. Gentle body massage is always good to keep the body fine. And the coconut milk, a small amount of coconut milk, even up to 20 to 30 ml of coconut milk is found very, very effective in many of the Parkinson's disease. So in summary, of course, we can treat Parkinson's disease. We can extend their quality of life very, very well. Few things you keep it in mind you're treating. Besides, you have a set of prescriptions, the drugs you have. You're seeing a set of prescriptions I mentioned. It's all common prescriptions, but be careful and look at the symptoms and prescribe aptly. But these are the few things you keep it in mind. One is Agni Bala should be maintained. Good Vatanulomana should be there. Don't make the patient to have constipation. Let me have some Anulomana drugs. It may be Varuni Thailam. It may be Nimbamrita castor oil. It may be a Gandharvastha Thailam. Preferably of a castor oil origin, or maybe better than a tablet or a powder. Don't give Avibhatti Churnam or Ichabhedirasam or Kayam tablet, these type of things, because these are all creating a sort of duksha. So if you are able to give some Snigdha Anulomana medicine, it is generally better. If you're still not available, you may try some low Anulomana medicines like Dashamula Haritaki, Kalyana Gulam type of medicines too. That's also not bad. And keep Niramavastha as much as possible. So the diet, the food when you're choosing is, you have to be very careful that person is not having a tendency to accumulate ama. Give some exercise. Ask them to avoid Vega Vidharana. Good sleep is a great contributor. Let them have a good sleep. Many times improper sleep is a very, it increases the tremor, it increases the mood disturbance and all. Try to give some Rasayana. Do Rasayana in the best person. Try to give some Rasayana. It may be Virabha Rasayanam you give. It may be Chayana Prasham you may give. It depends upon if you are not able to do Lashuna Rasayanam or other common Rasayanams, Chitra Rasayanam. It's not very easy to do. But you prescribe some of the Rasayanas. As I mentioned, Vrishya, Medya or Rasayana medicines have some results. So you can expect some minimum change in the patients. And another important thing, don't continuously give too much of Rukshana, Langana type of thing. And in the reverse way also, don't give too much of Brahmana. Okay, patient is admitted 2 weeks, okay, you are given a full 1 week full of Pichil, that Kayasega, then Thailadhara given, Vasti is given, fine. Then after 6 months or 1 year, the patient is getting again. So in the whole duration, you are given some Rasayanas and all. So don't give continuously Brahmana type of management. Try to mix Brahmana Langana things. And very importantly, never lose confidence to the patient. Patient often will have hopeless, helpless, useless feeling. So make them to convince them that, okay, you have a better quality of life. At least we may not be able to completely cure it, which we should not say to the patient, but definitely we can keep the quality of life even much, much better than before. And we may combine, if the disease is really progressing faster, we may combine with the modern medication plus Ayurveda. There is no problem. That is also absolutely problem. And at this moment, I'm thankful to of my father, Narayanan, Narayanan Nambi, Vaidyamadam Rishikumar Nambudri, even my close friend who was late, Prakash Mangalasheri, my friend, Italian Dr. Antonio Morandi, a great neurologist, and young generation, my generation neurologists like Jomon Joseph, they're all made a lot of contribution in this field, and we used to have a lot of discussion with these people whenever we get cases, and also that we could able to explore better possibilities. So it's a time for questions and discussion, I believe. Thank you for organizers for making right. Thank you.
Thank you so much, sir. On behalf of Ayurveda Map, I really thank you. It was a wonderful session. You have described each and every part, including your the patients you got, everything. So experiences also. So thank you so much for sharing a lot of ideas, sir. So we have a few questions, sir. Can I read it out if you're okay?
Oh, sure, sure.
Okay, sir. So there is the first question from Dr. Chandani. How we differentiate between Vata Pradhana and Kapha Pradhana Kampavada?
Vata Pradhana and
Kapha Pradhana.
Okay, that's very simple. You look at the symptomatology, enlist the symptomatology, and for example, you have 10 symptoms, out of which 7 or 8 symptoms are Vata dominant, like tremor. There are typical Vata dominant symptoms are there, so you consider this as a Vata dominant. Whereas you have the Kapha dominant symptoms like bradykinesia, the mood, mild depressive mood is there, expressionless faces are there. These are all suggesting of Kapha dominant. So it's very simple. You just enlist the maximum number of symptoms, out of which is the larger, which is dominated. According to that, you can find the solution.
Okay, sir. Thank you. Sir, another question from Dr. Tara. Is Varuni Taila be used in tremor predominant also?
Yes, definitely. Varuni Taila can also used in the tremor predominant. There is no problem. But thing is that when you have a tremor dominant cases, it is generally Vata dominant. So such people, when they take Varuni Tailam, they will have some contractions in the abdomen, slightly strong. That is a personal experience. So Varuni Tailam, we have to reduce the dose because of the, Varuni is the Indra Varuni is a drug which is having a strong peristaltic tendencies. So Durva Swarasam is added while preparing this to reduce its hyperperistaltic disturbances. So when you are a patient with a Vata dominant, that means a tremor dominant Parkinson's disease, you can use it, but your dose may be a little bit less. That's the thing.
Okay, sir. Thank you. Sir, another question. How is Lashuna Rasayana given practically?
Practically, you should have, just like in a Pippali Vardhamana Rasayana, you can prepare Lashuna. There is a prescription in the Charaka Samhita. You take Charaka Samhita Rasayana Adhyayam, you have a formula how to prepare Lashuna into Rasayana. And you can prepare like Avalehya, and you start giving in the morning in a smaller dose and increase the dose. The easiest way in the practice is that you do that. Instead of breakfast, you give Rasayana. For example, you started Rasayana. If you careful, the person should not be a Pitta Prakriti, not in the Pitta Prakriti. You could not give. Should be a very Kapha Prakriti, best result. If it is Vata Prakriti, also may have some problem. What you do, start with 5 grams first. So wait for have the Lashuna, 5 grams that Lashuna Rasayana. Then wait for 1.5 hours, have a milk, a diet, slight milk with rice and dal and all. They can have a brunch, then can have lunch later. Then you increase the dose, 10 grams, 15 grams, 20 grams, depends upon that. So generally you break the breakfast like that. It's very effective, very, very effective. Lashuna Rasayanam is a good thing. It's a challenging situation, but you'll get very good result.
Okay, sir. Sir, you had mentioned a lot of rasayanas. So is there any specific anupana that you would like to say?
Generally, whether it is Lashuna, whether it is a Pippali, one common thing is that you'll have an adjuvant. Anupana is a milk. Because kapha manda vada pitta, whenever we have increased kapha and vada pitta, increased vada pitta and kapha low, milk is the best medicine of choice. So here in situations, most of the time these things will increase a pitta a lot, also vada a lot. So when you have vada pitta dominant situation comes, generally the easiest, cheapest and the best satmya material is none other than the milk. So because of that reasons, we have Lashuna as the major thing for, milk is the major thing for rasayana.
Okay, sir. Sir, there is a question from Dr. Karthika. Sir, a patient on sodium valproate, like medicine, later develops Parkinson. How to adopt the treatment protocol?
Very good question. Very good. Sodium valproate is one of the common drug. Lithium, sodium valproate. These are the common drug which is behind to manifest this type of Parkinson's disease. So you have to be very careful because anti-convulsive, anti-epileptic drug, sodium valproate is a very common prescription for epilepsy. So you cannot, all of a sudden, you cannot stop this drug because our body is already conditioned to have this type of thing. But what you should do is that to reduce this sodium valproate percent, you do Tailadhara in the body, especially Rasnadi Thailam and or Tailadhara. Then you give Nasya to the patient. You will get better result. Instead of giving extremity medicines like Kaya Segam, Pirichil or Kaya Segam, Vasti and all, better you focus on head treatments. Murtha Taila Prayogas, you will get a better result when you have a sodium valproate thing.
Okay. Sir, in that case, what kind of Murtha Taila should we adopt to?
Tailadhara is the best one. Since we cannot do Shirovasti, Tailadhara is the best one. If it is the person is not in hospital, in the house we can do Shiropichu.
Okay.
Depends upon that. If it is better, we use either Rasnadi Thailam or Mahamasha Thailam. Both the oils shows very good result.
Okay. Sir, as you had mentioned about the Rasayana treatment, there is one question. In a diabetic condition, can Rasayana be administered?
Oh yes. Shilajitu Rasayanam is a very good thing in the diabetic conditions. It can work for both. Because Mutra Jeshu Girijam. So you can use it with both the conditions.
Sir, another question. Kapikachu, when we are administering Kapikachu, should it be given with honey or warm water or any other anupanas?
Honey is a good thing, or better is a Kshirapaka. I prefer Kshirapaka of Kapikachu. Is a better choice, not alone, also maybe combination with Shatavari and all thing. Honey also fine, but warm water I don't, because Kapikachu, when you use the purification of the Kapikachu is not done properly. People may have a lot of itching sensation. They'll have a lot of hypersensitivity reactions and all. So once you are giving with the milk, that problem can be solved easily.
Okay, sir. Sir, another one. How about introducing Kapacha Unmada treatment in tremor predominant Kambavada also? It seems that she has tried in 3 patients and got good results.
Okay, Kabaja Unmada Chikitsa is have some link, as I mentioned, in the patient with Parkinson's disease. They have very oftenly they have a problem related with mood. Very oftenly they have fluctuations on their thoughts, behaviors, and all. So the basic principles of Kabaja Unmada Chikitsa is to have Shodhana Chikitsas using Manasamitram or giving Nasyam and all. Definitely it will bring good result. no doubt at all. But I normally, if you give in a tremor predominant one, tremor predominant is a little bit Vada dominant one. That you have to keep it in mind, because maybe normally people don't categorize that into Vada Kapha Pradhana, Kapha Vada Pradhana. Both they will consider as the same. But okay, initially when you get one cases and all, you'll see, okay, just like you're seeing one elephant, if you see 5 elephants, all the 5 elephants look same. But if you see 50 elephants, then you will able to differentiate, oh, all the elephants have same commonality, but there is Samanya and there is also Vishesha. Similar way, in a year, if you see 30 or 40 Parkinson's disease patient, you will able to differentiate, oh, there is a slight difference. Not all the patients have tremor, not all the patients have all the things. It's okay, fine, you'll get result. It's fine, very good to do. But when you have a larger number of patients, if you see in a year 30, 40 patients and all, you will have some Vishesha Chikitsa, you may categorize according to that. That's the only thing. Good, you continue that way.
Okay, sir. Sir, can this progressive supranuclear palsy or Parkinson's plus syndrome treated in the same modality as Parkinson's disease?
Okay, very good question. PSP and Parkinson's plus and all are a little more complex, and it may have more challenges. This also comes under the movement disorders, in that it have more challenges in the treatment. But general approach will be the same, like when we can use Brahmana Chikitsa, we can do Shodhana Chikitsa if the people conditions are ready. But PSP and Parkinson's plus, initially you will get good result, but in the later stages, prognosis is not very good.
Okay. Sir, there's a small question about the Kapikachu again. Can we give Kapikachu along with the modern medicines like L-Dopa and all?
Of course. Many times people, those already have Parkinson's disease for 5, 6 years and all, they already under dopamine. So they may be already taking L-Dopa maybe 4 times a day, like every 3rd hourly, every 4th hourly, like that. So you cannot stop that and give Kapikachu. So you give Kapikachu in our own way, let them patient continue L-Dopa, that's okay. Because don't think that, okay, the question I understand, because that Kapikachu also containing some dopamine, natural dopamine. So may think about the conflict of to dopamine. Not because you leave about that modern pharmacological perception. You think from Ayurveda, you give it.
Okay. Sir, what can be done in aphasic patients? Aphasic patients.
Aphasic patient, we also have to give some treatment in the oral treatments. One simple thing which give good result is you prepare Kshirapaka. Kshirapaka. That means I mentioned already with Kshirapaka in the slide. Shatavari. Can you permit me to share my screen?
Sure.
Okay. Yeah, I mentioned here some Kshirapaka. You see, Vasya with Kapikachu, Belamula, Ashwagandha. This Kshirapaka. You do one thing, you prepare a Kshirapaka and you ask the patient to inhale this Kshirapaka. It's called Kshiradhuma. So like a person head is covered, just like we take the, when we get cold and cough, you take the steaming. Similar way, you take inhalation. This gives one good result. Second thing we can try, which gives also very good result, is what I use is the Kalyanagulam, a formula which is a Virajana medicine. Kalyanagulam, you ask the patient to have rubbing of Kalyanagulam in the tongue, applying in the tongue. And also another formula is that Vacha Rudraksha Swarna Yashti combination. Vacha Rudraksha Yashti combinations. If you get little gold, also fine. Make like a paste and apply in the tongue. Also give very good result.
Okay. Sir, can Ashwagandha Churna be given alone with milk as an Anupana?
Yes, of course. The thing is that when you give ashwagandha, try longer time, it is found that people are creating some ama. So try to use ashwagandha churna plus panchakola churna.
Okay.
It is better. So if you are giving ashwagandha churna 3 grams or 5 grams, so 3 grams of ashwagandha churna, 2 grams of panchakola churna, mix it and ask the person to take. So this can avoid the excessive, accumulation of ama because of the presence of panchakola churna.
Okay, sir. Sir, there is another detailed question from Dr. Anushree. A patient having creatinine level 4.3. He is now having difficulty in walking and left side is having weakness. He is continuing the physiotherapy. Can he take kashayas and other external therapies?
Of course, why not? I think this, do you think Anushri is describing this patient with a PD or a stroke? Maybe the creatine 4.3 suspecting of some chronic kidney disease, or is it something else? What is the renal pathology? I didn't understand. But anyhow, you can give kashayams and all. Don't worry about the creatinine level. You can give kashayam. There's no problem in that.
Okay.
Only thing you have to be careful while giving kashayam, that kashayam not containing like Gugulu Tiktaka Kritam or Varana Kritam, like Phaladaka ingredient and all, better not to give. Maybe use Brahatyadi Kashayam, Trinapanchamulang Kashayam, this type of things may be better.
Okay, sir. Sir, can you share your experience on the progressive supranuclear palsy, as it also have rigidity and bradykinesia and similar symptoms of Parkinson's?
As I mentioned before, PSP again it needs another lessons because it comes under the movement disorder, but you need more careful treatment of PSP because it's more complex. It has more avarana tendencies. The line of treatment for Parkinson's and PSP may be the same. Okay. But just like when you have Vada Kapha dominant situation, instead you have Kapha Vada dominant situation, where in the course of the treatment, when you find some, you find some avarana presentation in between and all, PSP is it's a bit more challenging. That's the thing I should say at this moment.
Sir, does acupuncture or acupressure have any effect?
Oh, I'm very sorry. I have no idea. No idea about acupuncture or acupressure. Sorry, I don't know.
Sir, another question. Can you please tell the line of treatment for spinocerebellar ataxia? Is treatment like PD?
Okay. Ataxia is another akinetic categories where it is an irregularity in this. It's not as complicated as Parkinson's disease. Maybe we have to rule out the possible why it is happening, whether it is where it started and it's what is the pathology behind this ataxia. But generally, it will not worsen as like PSP or PD. You can treat spinocerebellar ataxia almost in the line of Vada Vyadhi Chikitsa, and you will get good result.
Sir, does Agni Karma Chikitsa or Vidha Chikitsa have anything to do with Parkinson's?
I am a Kaya Chikitsa person, so I didn't try any Agni Karma. And where to do Agni Karma is a question. I didn't know.
Okay, sir. Thank you. Sir, Parkinson's with hypertension management.
It's almost the same. Hypertension you parallelly manage with that. That's it's nothing to do with that.
Okay, sir. There are many questions like the dosage of Shilajatu Rasayana and Suvarna Bhasma.
Okay, you get Shilajatu in a Shilajatu Rasayana itself in the market, and you increase the dosage. You start with or 250 milligrams and like that you get, and then you increase the dosage. Swarna Bhasma, you have to be careful, not too much to give because sometimes they may have some problems while giving Swarna Bhasma. I found some people have some difficulty in digestion and end up with some complication. But generally, this is the way. You start with a small dose in English into 1 gram like that, but not Swarnabhasma 1 gram. It may be very low dose.
Okay, sir. Sir, do you have any comment on the proportion, why the proportion of male is more than the female in Parkinson's disease?
Very good question. Truly speaking, I don't know actually why male is more. And maybe because of so far the brain as a structure is concerned, there is no much differences generally, not like in the other internal organs like the heart, lungs, other things. There may be slight changes even in the abdominal organs, but so far the brain is concerned, not very significant changes are found. No idea. Maybe a statistical possibility is that males are more vulnerable, maybe because of the trauma they face in the stressful life. Maybe the reason.
Sir, there is a question from Dr. Ajay Kumar. He is saying that he is having a patient who is totally aphasic and dysphagic. So it means that he can't inhale as told by you. And he tried Vacha Lepam, but it didn't give any much effect. So can you please suggest him some medicines or treatments?
Okay, if it is if Vacha Lepam is not affected well, think about the problems of the cranial nerve, or if it is whether it is anything related with the cranial, as well as think about the bulbar issues and all. Exclude the possibility of bulbar issues. And Kshiradhumam is a good choice where you give Kshiradhuma, can give some good result in such cases. Try to use Kalyanagulam. You can, Dr. Ajay Kumar, you tried Kalyanagulam. Ask the patient to take Kalyanagulam in that spoon, like then have just like tooth powder massage in the tooth. They have to take this Kalyanagulam in the tongue massage, shown good result.
Okay. Sir, another question from Dr. Hemalata. For prevention of PD, which medicine has to be taken at which age? Has it to be started, dosage, and any duration that you would like to say?
It's a bit complex question because prevention is always a challenge. But still, the simplest thing I should give to the advice to the people: the person is of Kapha Vada Pradhana or Vata Kapha Pradhana. At this century, the simplest, cheapest, easiest rasayana is Lashuna rasayana. Taking every day few part of garlic in a milk every day definitely can do miracles and wonders, including cardiac disease, including many Parkinson's disease. I believe so. Because this is the easiest, cheapest one, easily available, and just take a few parts of garlic. Well, but while using garlic, be careful that don't use the germinal part of it. Take out the outer cover, cut the garlic into half. So in the center part, you have that germinal, the center thing. You remove that, then you put it in the milk and boil and drink
that. Sir, if hemorrhage after Parkinson's in old age, any treatment that can be prescribed?
Okay. Hemorrhage after Parkinson's. Okay. This means that then it's more complicated. If it is a hemorrhage is manifested, because then there may be some previous history of infarctions. So it may be a transient ischemic attack and manifesting into that. So you have to be a little more careful, such cases. It's difficult to treat. I commonly use a formula called Mahamanjishtadi Kashayam. A Charangadhara formula is there. It's available in the market also. This is good for both. Good for Pachakada, good for hemorrhage, good for Parkinson's disease also. Try to prepare Mahamanjishtadi Kashayam, give two or three times every day. Can bring some improvement.
Okay, sir. Sir, there is another question. Lashuna and Kshira, is it Viruddhahara as Kshira is told as Apatya in Lashuna Rasayana? So,
No, it is not Apatya. You can use it. You can use it.
okay, sir. Sir, for Kapha Prakriti, can we use Lashuna Rasayana?
Kapha Prakriti, Kapha Prakriti, we can give lesson Rasayana. Yes, definitely. Definitely, we can give.
Okay. Sir, there are some cases wherein people post their after their like say if they had a stroke and all, like almost a 65 years old person presenting with 3 times stroke and all, if he presents with this Parkinson's disease, so can we start with Kapikachu?
Sorry?
Sir, a person present, a 65-year-old male person presenting with Parkinson's disease, which occurred due to which after having 3 times stroke. So, can we prescribe him Kapikachu or anything that you would like to give us as a prescription, sir?
Oh, there is no problem in giving Kapikachu in that situation.
Okay. Sir, since he had a stroke condition also, is Lashuna Rasayana more beneficial or Kapikachu? Anything specific, sir?
No, I prefer such situations. I don't prefer Lashuna Rasayana and all. Instead, I used to give Dhanadhanayinadi Kashayam, Varuni Thailam, this type of medicine. Don't use this type of Lashana Rasayana aggressive way. Try to use Dhanadhanayinadi Kashayam, Varuni Thailam, then some arishtams like Dhanundara Arishtam, Ashwagandha Arishtam. Combinations are good, brings good result.
Okay, sir. Sir, just like you had told that Lashuna Rasayana for Vata predominant cases. So in Pitta Prakriti cases, which Rasayana can be prescribed, sir?
Pitta Prakriti option is only with the Shilajitu is there. But I prefer such situations. I use a yogam called Shadavari Chinnaruhadi Kashayam. In the Sahasra Yogam, you get a Kashaya called Shadavari Chinnaruha starting.
Yes,
Or the Vaishnaratnavali Yoga, Mashatmuppa and Vathyala Rashidam Piped, we can use. Or Vidajyadi Ganam also very good.
Sir, in Gritapana, when we are Gritapana, which Grita do you suggest?
Okay, it is always to use a krida which is having some anulomana subhava, like Dadimadi Kridam. I often try Dadimadi Kridam in this patient because Dadimat Kudobo Thanyat Kudabadram Palam Palam Chitragam Chingi Veremcha. It is containing only few herbs are there, or 4 or 5 herbs are there. One of the major drug is Chitraga. Then, so that this type of wherever Chitraga comes play in the role, it will do the Shodho Shodhana, it do Anulomana, it does so many things. Not that only for Chidundadi and other things and all, because there are poisonous drugs. What is there in our formula? These type of yogas are very potent. Whenever you have Bhaladaka in the yogam, like in the Gugulu Diktuka Varanadi, they are very potent. They are the flag, they have a flag in front and they do many miracles. Similar way, Dadimadikradam is excellent. I use Dadimadikradam. Very palatable also, easy to drink also.
Okay, sir. Is Varuni Thaila available in market? And
yes, it is available in the market. SNA also the Shala produces Varuni Thaila.
Sir, Kalyana Gulam and Sukumara Rasayana to be given in which conditions, sir?
Kalyana Gulam generally helpful for whenever you have problems starting with Apanavata problems And especially when you want to have a saraguna, have mild laxative, lower colon areas when person is having, or in the mouth and all, they have recurrent difficulty, they may have a dysarthria and all, Kalyana Gulam is very good. Whereas Sugmara Rasayanam is more good when you have mood disturbances, gut disturbances, or the person saying, I have a distension of feeling abdomen, my digestion is not happening properly. And maybe that's why in the Balashruti, Sugmaram Alakshmi Kalinashanam, in the Balashruti of Sugmara, you'll get two words. One is Alakshmi Kalinashanam. These two words are representing the mood disturbance of the person. He feels hopeless, helpless. Oh, no Lakshmi, no money. It's not a matter of money. Rather, he feels that I'm hopeless, helpless, and useless for the society. So Kalinashanam, feeling irritated. Kalinashanam means getting disturbed by, it's not able to adjust with the given situations and all. So whenever you read the Balashruti and all, very, very significant that each will have some clinical setup in a clinical perception. It's not simply that, okay, Kali Deva comes and kills that and all. These are all very powerful clinical representations in the practice.
Right, sir. So that is almost the end of the question, sir. Thank you so much for patiently answering each and every questions raised by our participants. Sir, now I invite Dr. Jasul for the vote of thanks.
Thank you, sir. Thank you very much for your excellent presentation. And I invite Dr. P. Rahmatullah, sir, from our sponsor side, Kottakkal Ayurveda Pharmacy, Kottakkal. Hello, sir.
So I also want to say thank you to my participants. Thank you all.
Yes, Dr. Rahmatullah.
Hello.
Hello, sir. We can hear you.
Good evening to all.
Good evening.
Okay. Good evening to all. Thanks, Dr. Narayanan Nambi, for your wonderful class. I believe this is one of the best class in this ANUBHAVA session. You covered all the part of the Parkinson's disease with your valuable experience. Also, this good for the all the doctors is with this webinar. I am your brother, Pasivan Mus classmate, yearmate. I am Kottakkal, studying in Kottakkal at that time.
Vasudevan's younger brother.
Yeah. This is happy with your presence in this webinar also. Okay, we are again expecting your cooperation for this program. Okay, thanks to Jasul and this Ayurveda Map conducting people, all of them. Okay, good night.
Okay, thank you, sir. Thank you very much for sponsoring also. Over to you, Dr. Radhika.
Okay, thank you, sir. Sir, words won't be enough to thank you, Dr. Narayanan Nambi, sir, for your wonderful presentation. Once again, on behalf of ANUBHAVA series, I thank you wholeheartedly for your patient answering and also giving us such an informative and experiential class, sir. Thank you so much, sir.
Okay, Dr. Radhika, we can have some feedbacks. Okay.
Yes, sure, sir.
Yes, participants can have their feedbacks in the chat also, or if anyone need to speak, please raise your hand. Okay.
If any of the participants who wish to give us a good feedback, please do. Yes, Dr. Ajay Kumar.
Yes. Okay, Dr. Ajay Kumar, you can have your feedback. I think some issues.
Dr. Ajay Kumar.
No, we can invite any other person. Okay.
Hello, sir. Hello.
Yes.
Hello, sir. Sir, I am Dr. Ajay, professor in Kriya Sharir from SBMN College, Rohtak, Haryana. Namaste, sir. Sir, it was a great presentation, and actually, my father is suffering from Parkinson's since 4 years, and I got your about this lecture from Telegram, and it's a great hope for me and lots of people like me regarding Parkinson's. So I'm really thankful for such a presentation and such a hope. And I would like to be in contact with you regarding my father and other people who are suffering from such problems. So thank you, sir. Thanks a lot.
Sure, sir. Sure.
Thank you, sir.
Thank you, Dr. Ajay Kumar. Anyone else who wish to give us a feedback? Participants, you can raise your hand so that I can help you speak. There has been a lot of feedbacks coming in the chat box.
Okay, thank you, Dr. Ashu. Thank you, Dr. Sriram Shiva Kalyan. And thank you, Dr. Sujata. Yes, we have so many feedbacks in the chat.
So the recordings will be available in the YouTube. So we have put the YouTube link in the chat box, so you can view our session in the YouTube also.
Okay, thank you everyone. We can wind up the session.
Okay, so thank you one and all for joining us for this Anubhava free webinar series. And once again, thank you so much, Dr. Narayanan Nambi sir, for a wonderful session. And good night, everyone. Thank you.